Welcome to Sectional Anatomy, Chapter 1. This video is for MRI students or individuals who want to learn basic sectional anatomy. The information in this video is credited to the book, Sectional Anatomy, written by Lori Kelly and Connie Peterson, Wikipedia, and many sources. Sectional anatomy has a history that started as early as the 16th century. The great anatomist and artist Leonardo da Vinci was among the first to represent autotomic sections. He had to illustrate all the images by hand, believe it or not. The ability to see inside the body for medical purposes was when Wilhelm Conrad Röntgen discovered X-rays since 1985. Since then, medical imaging has evolved from 2D X-rays images to 2D computed tomography, CT, and magnetic resonance imaging, then to the 3D that we use today. Sectional anatomy emphasizes the physical relationship between internal structures. For example, it may be difficult to recognize all the internal anatomy of the pelvis in cross-section, but by identifying the femoral head on the image, it will be easier to recognize soft tissue structures adjacent to the hip as in the image. Now, let's talk about the anatomic position and planes. In medical anatomic position, the body is standing erect, with the face and toes pointing forward and the arms at the side, with the palms facing forward. This is another image to demonstrate the anatomic position. Now, let's discuss anatomic planes. Sectional images are commonly acquired and displayed according to one of the four fundamental anatomic planes: sagittal plane, coronal plane, axial, transverse, plane, and oblique plane. The sagittal plane is a vertical plane that passes through the body, dividing it into left and right. Coronal plane is a vertical plane that passes through the body, dividing it into anterior, ventral, and posterior, dorsal, positions. You can say it's dividing from front to back and vice versa. See the orange color. An axial or transverse plane is a horizontal plane that passes through the body, dividing it into superior and inferior portions. Oblique plane is a plane that passes diagonally between the axes of two planes. These are some of examples of images in different planes. This one is the axial CT of the abdomen. 3D CT of the pelvis, anterior view. Now, we are going to learn about anatomic directional terminology. We will cover each of these in alphabetical order as in the table below. Superior means above, at a higher level. Inferior means below, at a lower level. For example, the eyes are superior to the mouth. The belly button is inferior to the chin. This is another image of superior and inferior. You can think of superior as up, and inferior as down. Anterior and ventral means toward the front or anterior surface of the body. Posterior and dorsal means toward the back or posterior surface of the body. Medial means toward the mid-sagittal plane. Lateral means away from the mid-sagittal plane. Proximal, toward a reference point or source within the body. Closer to the reference point. Distal, away from a reference point or source within the body. Think of distal as distant, far. Superficial is near the body's surface. Deep is farther into the body, far from the body's surface. For example, arteries are deep and veins are superficial. Cranial and cephalic means toward the head. Caudal means toward the feet. Rostral means toward the nose. Ipsilateral means on the same side. You can see the shaded areas of the arm and leg are on the same side. Contralateral means on the opposite side. Thenar is the fleshy part of the hand at the base of the thumb. Volar is pertaining to the palm of the hand or the flexor of the surface of the wrist. You just learned all these terms. You can try to memorize this table. Here is a quick summary of some of the directional terminology. Medial versus lateral. Superior versus inferior. The anterior is opposite to the posterior. Proximal is opposite to distal. Superficial versus deep. Ipsilateral versus contralateral. Okay, we now have to learn the anatomic regional terminology. Regional terminology is used to reference anatomical structures or areas of the body. Similar to directional terminology, regional terminology is necessary for both being able to describe areas of interest and interpret prescriptions. An example of using regional terminology would be as follows. A patient complains of headaches that only occur at the back of the head. This can be communicated to the radiologist as occipital headaches. There are quite a few terms. We are going to learn one by one in the alphabetical order of this table. Here is the abdominal area. See the red circle. Antebrachial means the forearm. Antecubital is the front of the elbow. Axillary means armpit. Brachial is the upper arm. The calf is the lower posterior porter of the leg. Carpal means wrist. Cephalic means head. Cervical means neck. Costal means ribs. Cubital means the posterior surface of the elbow of the arm. Femoral means thigh area. Flank means the side of the trunk adjoining the lumbar region. Most of the time, the flank area is used to access and feel the kidneys. Gluteal is the buttock. Inguinal is groin. Lumbar is the lower back between the ribs and hips. Mammary is the upper chest or breast. Occipital means the back of the head. Ophthalmic means eye. Pectoral means upper chest or breast. Pelvic is the pelvis. Perineal means perineum. Plantar is the sole of the foot. The popliteal is the back of the knee. Sacral means sacrum. Sternal is sternum. Thigh is the upper portion of the legs. Thoracic is the chest area. Umbilical is the navel. Vertebral means spine. We are done with the anatomic regional terminology. Too much? Is your head spinning yet? Now we have to learn the body cavities. Two main cavities, dorsal and central cavities. Dorsal cavity, located posteriorly, in the back, and includes the cranial and spinal cavities. Ventral cavity, largest cavity, subdivided into thoracic and abdominopelvic cavities. The thoracic cavity further subdivided into two lateral pleural cavities, purple color, and a single, centrally located cavity called mediastinum, orange. The abdominopelvic cavity is subdivided into the abdominal, pink, and pelvic cavities, neon green. Look at this image carefully. We will try to identify each structure in the following slides. You got all those? Let's see if we can do them all correctly. A is mediastinum. B is the thoracic cavity. C is the pleural cavity. D is the abdominal cavity. E is the abdominopelvic cavity. F is the spleen. G is the stomach. H is the transverse colon. I is the descending colon. J is the pelvic cavity. K is the appendix. L is the ascending colon. M is the small intestine. N is the pancreas. O is the liver. P is the diaphragm. Q is the heart. R is the lung. S is the trachea. Just a few more. You can do it. A is the brain in the cranial cavity. B is the spinal cord in the vertebral canal or spinal cavity. C is the dorsal cavity. H is the pelvic cavity. G is the abdominal cavity. F is the diaphragm. D is the thoracic cavity. And I is the ventral cavities. Now you can try these by yourself. Just kidding. We now have to learn the external landmarks. External landmarks of the body are helpful in identifying the location of many internal structures. The thyroid cartilage is at C5. The jugular notch is around T2 and T3. The sternal angle is around T4 and T5. Xiphoid process is at T10. Costal margin is at L3. The umbilicus level is around L3 and L4. Crest of the ilium is around L4. The anterior and superior iliac spine is at S1. Syphysis pubis and greater trochanters are at the same level as the coccyx. The external auditory meatus, EAM, is at the ear. The mastoid process has a tip that is located posterior and inferior to the ear canal, lateral to the styloid process, and appears as a conical or pyramidal projection. It forms a bony prominence behind and below the ear. Vertebra prominence is the name of the seventh cervical vertebra. The seventh cervical vertebra, C7, is the largest and most inferior vertebra in the neck region. Unlike the other cervical vertebrae, the C7 has a large spinous process that protrudes posteriorly toward the skin at the back of the neck. The jugular notch, suprasternal notch, presternal notch, is at the center of the superior border of the manubrium of the sternum, around T2 and T3. The thyroid cartilage is the largest cartilage of the larynx and is composed of hyaline cartilage. It sits beneath the hyoid bone to which it connects by the thyrohyoid membrane. Inferiorly it articulates with the cricoid cartilage. The gonion is a cephalometric landmark located at the lowest, posterior, and lateral point on the angle. This site is at the apex of the maximum curvature of the mandible, where the ascending ramus becomes the body of the mandible. In the anterior mid-sagittal plane at their junction with each other, the maxillary bones form a pointed, forward-projecting process called the anterior nasal spine. The midpoint of this prominence is called the acanthion. The nasion is the indentation between the forehead and the nose. Anatomic internal landmarks. We have to learn these. Aortic arch is about 2.5 centimeters below the jugular notch. Aortic bifurcation is at the level of L4, L5. Carina is at the bottom of the trachea at the point where it bifurcates or splits into the left and right bronchi, T4, T5 and sternal angle. Carotid bifurcation is around the upper border of thyroid cartilage. Celiac trunk is about 4 cm above transpyloric plane. The circle of Willis is an arterial polygon, heptagon, formed as the internal carotid and vertebral systems anastomose around the optic chiasm infundibulum of the pituitary stalk in the suprasellar cistern. Common iliac vein bifurcation is at the upper margin of the sacroiliac joint. Conus medullaris is around the T12 to L1 and L2. The heart apex is at the fifth intercostal space, left midclavicular line. Another view of the heart apex. The heart base is the fifth level of the second and third costal cartilages behind the sternum. The inferior mesenteric artery, IMA, 4 cm above the bifurcation of the abdominal aorta. Inferior vena cava is around the L5. Portal vein is at the posterior to the pancreatic neck. Renal arteries is at the anterior to L1, inferior to superior mesenteric artery. Superior mesenteric artery, SMA, about 2 cm above the transpyloric plane. Thyroid gland is below the thyroid cartilage. Vocal cords are midway between the superior and inferior border of the thyroid cartilage. There are 4 anatomic quadrants: right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. The right upper quadrant consists of the right lobe of liver, gallbladder, right kidney, portions of the stomach, and small and large intestines. The right lower quadrant consists of cecum, appendix, portions of small intestine, right ureter, right ovary, and right spermatic cord. The left upper quadrant consists of left lobe of liver, stomach, tail of the pancreas, left kidney, spleen, and portions of large intestines. The left lower quadrant consists of most of small intestine, portions of large intestine, left ureter, left ovary, and left spermatic cord. The abdomen further divides into 9 regions. The superior portion of these 9 regions has right hypochondrium, epigastrium, and left hypochondrium. The middle portion has right lateral, umbilical, and left lateral. The inferior portion has right inguinal, hypogastrium, and left inguinal. We are done with the anatomy portion of Chapter 1. Next, we will cover quickly about the imaging in MRI. Image acquisition and display. MRI uses a strong magnetic field in conjunction with non-ionizing radiofrequency energy to acquire images. CT uses ionizing radiation to acquire images. Both modalities are capable of creating 2D and 3D images. Each digital image is divided into regions called pixels or voxels that are then assigned to numerical values corresponding to a specific tissue property of the structure being imaged, as in this picture below. The numeric value of each voxel is assigned a shade of gray for image display. In CT, the numerical value is called the Hounsfield unit, Hu, which represents the attenuating properties or density of each tissue. Water has a value of 0. In MR, the grayscale represents the specific tissue relaxation properties of T1, T2, and proton density. The grayscan in MR images can vary greatly because of inherent tissue properties and can appear different with each patient and across a series of images. Windowing. The appearance of digital images can be altered to include more or fewer shades of gray by adjusting the grayscale. Windowing is used to optimize the visualization of specific tissues or lesions. Window width, WW, is the parameter that allows for the adjustment of the grayscale, number of shades of gray. Window level, WL, basically sets the density of the image or the center of the grayscale. Several post-processing techniques can be applied to the original 2D digital data to provide additional 3D information. All current post-processing techniques depend on creating a digital data stack from the original 2D images, thereby generating a cube of digital information, as you see below. Multiplanar reformation, reformat, MPR, is images reconstructed from data obtained along any projection through the cube results in a sagittal, coronal, axial, or oblique image. Here are the results of the multiplanar reformation. Curved planar reformation, reformat, CPR, is images reconstructed from data obtained along an arbitrary curved projection through the cube. 3D imaging. All 3D algorithms are the principle of ray tracing in which imaginary rays are sent out from a camera viewpoint. The data are then rotated on an arbitrary axis, and the imaginary ray is passed through the date in specific increments. Depending on the method of reconstruction, unique information is projected onto the viewing plane. Shaded surface display, SSD. A ray from the camera's viewpoint is directed to stop at a particular user-defined threshold value. With this method, every voxel with a value greater than the selected threshold is rendered opaque, creating a surface. That value is then projected onto the viewing screen. Maximum intensity projection, MIP. A ray from the camera's viewpoint is directed to stop at voxel with the maximum signal intensity. With this method, only the brightest voxels will be mapped into the final image. Volume rendering, VR. The contributions of each voxel are summed along the course of the ray from the camera's viewpoint. The process is repeated numerous times to determine each pixel value that will be displayed in the final image. What planes are these? A is the sagittal plane of the lumbar. B is the coronal plane of the cervical. We are done with Chapter 1. Don't forget to watch the questions video for Chapter 1 to enhance your memory and understanding. Thank you for watching. Please subscribe, comment, like, and share.